Hi, everyone. This is Kelly Rock. I apologize for my delay in getting this announcement out to you. I'm making this recording on Tuesday evening. It's July 24th, and I just want to give you all a congratulations for getting through the first couple weeks in this very busy, accelerated psychiatric and mental health nursing course. I know that none of you come from a background that includes this specialty, but I can assure you that you're doing a great job. At least in the course, I hope that you feel like you're gaining some new information and putting some of the information into practice through some of the assignments. Really nice job on the theory theorist assignment, and certainly also with the scope and standards of practice. I was also impressed by the fact that you each chose a different standard of practice that you thought was most difficult to implement, and thought that all of you really had some pretty good points, especially coming from a medical surgical perspective. So one of you chose assessment, another chose implementation, coordination of care, and then also milieu therapy. Emily, I think it was you that chose milieu therapy, and you brought up some really interesting points. What I've done here is I pulled up my scope and standards of psychiatric and mental health nursing practice from the APNA website. I'm a member, and I just thought that I would turn to page 60 that talks specifically about milieu therapy, because the book does not go into any detail at all about it, and just wanted to explain it maybe a little bit better. So the competencies at the RN level include these dot points: orienting the healthcare consumer and family to the care environment, including the physical environment, the roles of different healthcare providers, how to be involved in the treatment and care delivery process, schedule of events pertinent to care and treatment, and expectations regarding safe and therapeutic behaviors. It could mean something like orienting healthcare consumers to their rights and responsibilities. So typically, when folks get admitted to the psych unit, we go over their commitment papers, and then we go over a bill of patient rights. And that is probably not something that you all are doing regularly on a medical surgical unit. Establishing a welcoming, trauma-sensitive environment using therapeutic interventions, including but not limited to sensory or relaxation rooms. Obviously, ongoing assessment in relation to the environment to guide nursing interventions and maintaining a safe environment. And that might look like maybe doing a room check every shift to make sure that nothing from the sharps closet has not made its way back to the sharps closet. So on a behavioral health unit, if folks are allowed to have certain items, they may only be able to have them if they sign them out or for certain hours, because of risks of maybe hurting themselves or hurting someone else. That would be an example of how we're providing milieu therapy. Selecting specific activities that meet the consumer's physical and mental health needs. Advocating to make sure that your patient is being treated in the least restrictive environment. Informing them in a culturally sensitive manner about the need for limits related to safety and the conditions necessary to remove the restrictions. And that's something that we do on a really daily basis or a shift-by-shift basis on a behavioral health unit. And providing support and validation to consumers when discussing their illness experience and seeking to prevent complications of their illness. So those are examples of things that we do in the milieu, and really the milieu is the environment. So it could be these specific examples. It could also be something that a charge nurse does in order to manage the environment. If we have somebody that is escalating on a behavioral health unit, because of the openness of many units, we may need to send other staff to shift the patients or move the patients to a different area in order to keep everyone safe. That's an example of milieu therapy. So there are so many different examples, and it's something that we really almost always talk about in regards to an inpatient unit, but it is kind of environment management but keeping it patient-centered, if that makes sense. So hopefully that takes a little bit of confusion out of what milieu therapy is. And I just quickly want to touch on this week's module. So we are focusing on chapters 9, 10, 11, 12, 13, and 14. All of the assignments for this week are due on Sunday, so you don't have any midweek assignments that are due. Module 3, Assignment 1 is a process recording and analysis. If you click on this PDF, you'll be taken right to the guide and the ideas behind what a process recording is, what it might look like. Please only use a short conversation or a little snippet of a conversation that you have with a patient for this. Otherwise, this could get really long and drawn out, and it doesn't need to be. It really just is a tool to help you gain some insight into your own interactions, your own responses, the way that that you kind of volley back and forth with a patient under your care. The rubric is included right here. And then let's go ahead and take a real quick look at the second assignment, which I think you'll find pretty routine. So I'm asking you to complete a biopsychosocial psychiatric nursing assessment with an individual in your care that has a psychiatric illness or history. If it doesn't have to be a client who is on your unit for a psychiatric purpose, but maybe somebody with a history of depression or anxiety or really any psychiatric disorder, that's fine. I ask you to turn to page 126 in your textbook. You're going to use box 10.1 in order to complete the assessment. With these exceptions, please do not use the person's name, and you don't need to sign the document before you upload it. I don't have a template. You can really just use a Word document and follow these elements in Roman numeral format if that's comfortable for you. And then you will see that each element is assigned a number of points in the rubric. Some elements are worth more points than others, so please make sure that you do pay attention to that whenever you're completing the assessment. And then last, there is a quiz for Module 3, same as the first two quizzes without any exception. If you all have any additional technical problems with Canvas in uploading a document or anything of that nature, please don't hesitate to reach out to me. That's why I'm here. I'm here to be a resource to you and to help in any way that I can. I know that there were some technical difficulties with the Module 2 assignments, and I do apologize for that. I have corrected it on my end, but I do apologize for the delay in getting that fixed. It took a little bit longer than I had anticipated. And that's it. Any questions, please ask. If they are general course questions, you can ask via the Q&A discussion board. Otherwise, you can always reach out to me. Thank you all, and I hope you have a great week.